Welcome again to the Medical Terminology Podcast. This episode is Chapter 11, Part 3, Eye Pathologies. Before I actually get into the pathologies, I'm going to begin by talking about the specialties because these can be often confused. The first one is ophthalmologist, ophthalmologist. First of all, notice that the spelling on this is a little tricky. There's a silent H after the P, OPH, and there's also an L that we often do not say, OPHTHALM. Usually we'll say ophthalmologist. You won't hear the L, ophthalmologist. Usually we're lazy and say ophthalmologist. So you want to be careful of that L and also the H. What is an ophthalmologist? Well, an ophthalmologist holds a medical degree, an MD, and specializes in diagnosing and treating disorders of the eyes. An ophthalmologist will prescribe medication and also perform surgery on the eyes. An optometrist, OPTOMETRIST, holds a Doctor of Optometry, that's an OD degree, and specializes in measuring the accuracy of vision and prescribing corrective lenses. In some states, an optometrist can prescribe medications for the eyes, but an optometrist is not going to perform surgery or become involved in complex diagnoses. And finally, we have an optician, OPTICIAN. And an optician is a specialist in fitting corrective lenses for glasses or contact lenses. When you go to the optical shop with your prescription from either an optometrist or an ophthalmologist, an optician is going to measure your face and make sure that your new glasses or contacts will properly fit you and that you're getting the actual prescription that you were given by the eye doctor. Okay, well, now that we've covered those three specialties, we're going to go ahead and talk about the general disorders. And I'm going to subdivide the general eye disorders into groups that will make them a little easier to digest and learn. The first group are the refractive disorders. And do you remember from reading the textbook what refraction refers to? Well, refraction refers to the bending of light rays. And when we're talking about refractive disorders, we're talking about disorders in how the light rays are bent when they enter the eye. Now, first of all, we do have a term that we use to describe normal refraction, and that's emmetropia. 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 And this means the normal relationship between the shape of the cornea and refraction. Emmetropia means you've got normal vision without corrective lenses or contact lenses. Now the opposite of that is ametropia. AMETROPIA. And ametropia is a general term that refers to any type of error of refraction in which images do not focus properly on the retina. If you have ametropia, that means you're going to need prescription glasses or contact lenses for some type of problem in seeing clearly. Now we have different types of ametropia. The first one is myopia, MYOPIA, and this is more commonly known as nearsightedness. In nearsightedness, the light rays focus in front of the retina, causing distant objects to be blurry, while close objects are in focus. And that's an important point, is when we talk about being sightedness, either nearsightedness or farsightedness, the term refers to how we see well. If you're nearsighted, you see well up close, but you do not see well far away. In hyperopia, commonly known as farsightedness, the light rays focus behind the retina, causing close objects to be blurry, while far objects are in focus. This would be the situation where you would need glasses to be able to read, but otherwise you would not need glasses. Related to that is presbyopia, presbyopia. And presbyo, if you remember, refers to aging. So presbyopia is a condition of aging in which the lens becomes less flexible and cannot focus properly. That results in hyperopia or farsightedness. This is like normal middle-aged eyes. Whenever you get to be around middle age, that's when you're going to start to need reading glasses simply because your lenses are less flexible and you just cannot focus light as well in the eye. And finally, we have astigmatism. astigmatism. And astigmatism is often referred to as a condition of near and farsightedness. Things are both blurry in the distance and up close. And this is caused by uneven curvatures of the cornea. Let's go ahead and do some practice. What is the term for a specialist in fitting corrective lenses or contacts? Well, that's the optician. optician. What is the general term for any refractive disorder? That's ametropia. ametropia. And what is the term for the condition that's commonly known as farsightedness? That's hyperopia. hyperopia. What is the term for the age-related condition in which the lens becomes inelastic and cannot focus on close objects? Well, it's age-related, so again, that would be presbyopia. presbyopia. And what is the term for the condition of both near and farsightedness that is caused by an irregular curvature of the cornea? That's astigmatism. astigmatism. What is the term for a medical specialist in diagnosing and treating diseases and disorders of the eyes? That's the ophthalmologist. ophthalmologist. And what is the term for the condition known as nearsightedness? That's myopia. myopia. A specialist in refraction who measures visual acuity and prescribes corrective lenses is known as a what? That's the optometrist. Optometrist. And finally, the term for the normal relationship between the shape of the eyeball and refraction is known as what? That's emmetropia. Emmetropia. And again, emmetropia means you've got normal vision without any refractive error. Okay, the second group of general disorders relates to loss of vision. The first term is amblyopia. Amblyopia. Amblyopia is a condition of dim or partial loss of vision without detectable disease of the eye. The next term is scotoma. Scotoma. And this is a condition of having a blind spot or an area of absent vision. Diplopia, Diplopia, refers to double vision. Again, diplo means double, opia, vision condition. Diplopia, double vision. The next term is hemianopia. Hemianopia. That word seems a little bit tricky, but we can break it down into its parts and it's easier to understand and spell. Hemi, Hemi, means half. An, if you remember, means without or absent or lack of. And again, opia is a vision condition. So hemianopia is a vision condition in which half of the visual field is absent or lacking. So basically, this is blindness in one half of the visual field. Monochromatism, monochromatism, refers to color blindness. Mono means one, chromato refers to color, and ism would be a condition, means that we have a condition of one color. That's not literally the case, but we use the term monochromatism to refer to color blindness. And finally, we have nyctalopia, Nyctalopia. And it breaks down into the word parts nyctalo and opia. Nyctalo, I hope you remember, refers to night. So this would be a condition of night blindness. And then the next little group of general disorders refers to alignment disorders, where the eyes do not align properly. First, we have a general term, strabismus, strabismus, and that refers to any disorder in which the eyes are not aligned correctly. And then we have two types of strabismus. The first one is esotropia, Esotropia. And this is the medical term for cross eyes, when one or both eyes abnormally turns inwards. Remember that eso means inwards, tropo means turn, and ia, again, would be a condition. Esotropia. Exotropia, Exotropia, is the medical term for walleye, and this is a condition in which one or both eyes abnormally turns outwards. Again, exo means outwards, tropo means turn, and ia means condition. Okay, well, let's go ahead and do some practice over these last two groups of terms. What is the medical term for double vision? That's diplopia, Diplopia. What is the term for blindness in one half of the visual field? That's hemianopia, Hemianopia. And what is the medical term for color blindness? Well, that's monochromatism, Monochromatism. Someone who has difficulty seeing at night has night blindness, which is also known as what? Well, the medical term for night blindness is nyctalopia, Nyctalopia. What is the general term for a disorder in which the eyes are not aligned correctly? That's strabismus, Strabismus. And what is the term for an abnormal blind spot? That's scotoma, Scotoma. And what is the medical term for cross eyes? Well, in this case, the eyes would be turning abnormally inward, and that would be esotropia, Esotropia. And someone who has abnormally dim vision has the condition known as what? That's amblyopia, Amblyopia. And what is the medical term for the condition in which one or both eyes abnormally turns outwards? That's exotropia, Exotropia. Okay, in part two, we have the pathologies of the adnexa. And do you remember what the adnexa is? Well, the adnexa are the accessory structures of the eye. These are things like the eyelid, the tear ducts, etc., that are not part of the eye itself, but they're accessories. Okay, the first term we have is blepharoptosis. Blepharoptosis. And this word is composed of the word parts blepharo and ptosis. And blepharoptosis means a drooping eyelid. The next term is conjunctivitis. Conjunctivitis. And as the word parts would tell us, this is an inflammation of the conjunctiva, and it's also commonly known as pink eye. And do you remember from our anatomy discussion what the conjunctiva is? Well, it's the membrane that is lining the eyelids. And our next term also relates to eyelids. It's ectropion, ectropion. It's composed of the word parts ec, ec, tropo, trop/o, and the suffix ion, ion. And ect is another prefix that refers to outward. Tropo means turn, and ion or ion means a condition. And this would be the condition of an eyelid turning outwards. The opposite of that is entropion, entropion. Again, we have the word parts en, tropo, and ion. And this is a condition in which the lower eyelid turns inward. And our next term is a little odd to pronounce and spell. It's chalazion, chalazion. And a chalazion is also known as an internal sty, and it's a swelling inside the eyelid that's resulting from an obstruction of a sebaceous gland. A similar but different term is hordeolum, hordeolum. This is also known as a sty, and this is a pus-filled lesion on the eyelid resulting from an infected sebaceous gland. So a hordeolum involves infection and a pus-filled lesion, whereas a chalazion, there's no infection, there's just an obstruction and some swelling. In part 3 of our pathologies, we have those that relate to the eye itself. The first one is anisocoria, anisocoria. And this is composed of the word parts aniso, coro, and ia. And this is a condition in which the pupils are uneven in size. The next term is nystagmus, nystagmus. This is a condition in which the eyes involuntarily shift from side to side, resulting in vertigo. And vertigo is itself a term that is sometimes confusing or gets confused. People often think of vertigo as just dizziness. Well, dizziness is not the same thing. If you're dizzy, you're kind of lightheaded, you might feel like you'll fall down or maybe faint. The vertigo is actually much more severe. It literally is the feeling that the room is spinning, and you have the visual anomaly of seeing the walls around you turning as if you're spinning around and around. It's a much more violent sensation. The next term most of us have probably heard of, and that's glaucoma, glaucoma. And glaucoma is a condition of increased ocular pressure that damages the optic nerve, resulting in blindness. Typically, the peripheral vision is lost first, creating kind of a tunnel vision, which then becomes worse until all vision is lost. And finally, we have macular degeneration, macular, degeneration, degeneration. Well, as the term would imply, this is when the macula degenerates. The macula becomes damaged, resulting in a loss of central vision. And there are 3 types that are mentioned. We have age-related. We have dry, which is caused by a deterioration of the cells in the macula. And then we have wet macular degeneration. And that's caused when bleeding blood vessels in the retina cause damage to the macula. Okay, and let's go ahead and do some practice over the last 2 groups of terms. What is the term for the condition of increased ocular pressure? Well, that's glaucoma, glaucoma. And what is the term for a condition commonly known as a sty, an infection of a sebaceous gland in the eyelid? Well, that's the hordeolum, Hordeolum. And what is the term for a drooping eyelid? Well, that's blepharoptosis, Blepharoptosis. And the condition in which the lower eyelid turns inward is known as what? Well, that's entropion, Entropion. And then we also have the condition in which the lower eyelid turns outward. And what is the term for that? That's ectropion, Ectropion. What is the term for an internal sty, a non-infectious blockage of a sebaceous gland in the eye? That's the chalazion, Chalazzion. And what is the term for a condition in which the eyes involuntarily shift from side to side, resulting in vertigo? Well, that's nystagmus, Nystagmus. And what is the term for the condition commonly known as pink eye? That's conjunctivitis, Conjunctivitis. And what is the term for the loss of central vision caused by damage to the macula? That's macular degeneration, Macular degeneration. And finally, the condition in which the pupils are of unequal size is known as what? Well, that's anisocoria, Anisocoria. Well, this ends this episode of the Medical Terminology Podcast.